The story that we're publishing in the journal Nature is all about rheumatoid arthritis and whether or not there are different types of rheumatoid arthritis that should be treated differently.
One of the big problems we have when we treat patients with rheumatoid arthritis is that although we have phenomenal drugs and great choices, we don't really know which patient will benefit from which choice. And if it's not the right drug for you, you still commit 3 to 6 months to it, medications and risk. So one of the goals of the AMP Consortium has been to understand RA so we can decide at the patient level what drug to choose, which is huge because the more quickly you can establish good control of the disease, the better long-term prognosis the patient has.
What we have done is taken a large number of patients' joint biopsy samples and analyzed these tissues using cutting-edge single-cell molecular technologies. What we've learned is that indeed there are patterns that are differentiating, or subgroups of RA can be defined based on what cell types and what molecular pathways are inside of their tissues. Now, most importantly, the pathways that are in these different types of RA already have signatures which may guide us to better defining the treatments that should be used for each of those subtypes.
This has really come together beautifully because what we were able to do now was identify several specific groupings, what we refer to in the study as the CTAPs, or cell type abundance. These different subsets of rheumatoid arthritis that are characterized by different cell types and had different clinical characteristics. Now, this is an early study. There may be more CTAPs, there may be some that don't end up being as relevant, but right now I think this is how we're starting to approach it, and hopefully this will give us a step forward in identifying exactly which subset of rheumatoid arthritis each patient will fit into.